Henderson. How you doing?
Very well, thank you. How are you?
Good. How long have you been a psychiatrist for?
I qualified at the end of 2019, so it's been almost 5 years.
Nice. And what made you get into psychiatry?
I think going back a very long time, I always really enjoyed people. I always really enjoyed getting to know people. You could call it nosiness, you could call it curiosity, but I always really loved kind of conversations, hearing people's stories. I think when I went through medical school, that was the common theme that I was the last one to leave the patient's bedside in wars. I wanted to keep talking. I wanted to keep knowing, yes, okay, you've got, pancreatitis, but so tell me about your drinking. Tell me where did that come from? The kind of questions, the curiosity, the kind of know and understand. And I think then gradually my understanding that actually in doing that is itself healing. People feel understood and heard, and that's actually a very healing thing. And that really struck me. So I think psychiatry made a lot of sense. And then when I finally got some experience in it as an intern, I just fell in love with it and knew that I would never do anything else but this. So
wow. And is there a specific type of psychiatry that you're specialized in per se?
I am. My day job is actually child and adolescent psychiatry. So I quite enjoy going back to the very beginning of people's lives and working with them and their families. I think that's what particularly interests me about that, is thinking not just about an individual, but thinking about, the different systems that we're all part of, whether it be a family system or a society or a school or a workplace, and how they shape how we see ourselves, how we see the world, our experience of mental health difficulties. That really fascinates me.
That's it sort of blows my mind to think that, kids and adolescents are going to see a psychiatrist so early on. It's like, wow, you're actually able to get a hold of the potential problems at the start before they get worse and worse as you become an adult when they're left untreated.
Idea.
What are some of the common patients, especially for the kids, that are coming in with mental health illnesses?
I think I would at that stage would be careful about calling them mental illnesses. Illness implies, like a cancer is an illness, like Crohn's inflammatory bowel disease is an illness, diabetes is an illness where a part of your body really goes very badly wrong. And in kids, you might see kids like that who are maybe at the very early stages of something like a bipolar illness or schizophrenia variant, unfortunately, and that's incredibly important that they see a psychiatrist at that time. Most of what I would see in that age group are kids that are struggling, and struggling often with things that are very understandable they would be struggling with, like bullying, the pressure on social media, anxiety about things that are happening at home in their families that have gotten to such an extent that it's really impacted their mental well-being, their mental functioning. But I wouldn't necessarily call it an illness at that point. I would call it a disorder, but even then that's still quite an ugly word. I think it's really just trying to meet someone where they're at and understand their pain, and that they're in pain, I suppose, is maybe the best way to put it.
And they're not living the life that they could be living.
Exactly. And often I'm working with kids and adolescents and young adults who, through many things that have happened to them, often in their early life experiences particularly, that have changed their trajectory, if you like, where they're kind of heading in life. And the way I always like to try and think about it is, if we can intervene now, then you can try and change that trajectory back to where they could have been going, their potential, that what's been taken from them in terms of perhaps their childhood, their innocence, their safety, to try and return that to them and try to build them back to a place where they can then go on and live healthy, happy lives. And the goal is obviously that they don't then need mental health services as an adult, and that they can go on and live their life as they want to.
So to specialize in, kids and adolescents, that means there's definitely a demand for it.
Yes, unfortunately, there's a lot of demand for it. There's not enough of us, and I do hear that a lot. And that people's distress of trying to find child psychiatrists, as you've said, it's not a small thing to think about. I'm going to take my 12-year-old or 15-year-old, or even a 6-year-old, a 9-year-old, and I'm going to take them in to see a doctor about their mind. That's a pretty confronting thing for most people, and not something that should be a typical part of people's lives. But unfortunately, there is a lot of demand for it. There's a lot of, and I think the particular skill set that psychiatrists bring is incredibly important. It's by no means the only, and not shouldn't be the primary kind of mental health clinician people should be seeing in most cases. They should be, people should be seeking support from people around them initially, their loved ones, but guidance officers, GPs, counselors, psychologists, speech and language therapists. There's so many different professionals out there working with kids and young people that have so much to offer, and a psychiatrist is just one aspect of that. But yes, unfortunately, there does seem to be a greater and greater demand, and a greater, I guess in some ways it's a good thing, because there's a greater awareness that there are potential solutions and supports and help out there offered by people like psychiatrists. I think that's kind of part of what drives this.
And what would you say would be the primary concerns that parents or guardians would be bringing in their child or adolescent to your clinic? What is the reoccurring theme there?
Well, I work publicly. I work in a public, so not a private clinic. So I'm often getting referrals from GPs and schools, and sometimes families themselves. And typically it's when things have really gotten to a crisis point. Things have gone very, very badly wrong. Things have gotten very desperate. The kind of typical things, obviously, unfortunately, are kids who are very low in their mood. They might meet criteria for depression, although it can present quite differently in young people than it does in compared to adults. And our understanding of what depression is in adults is a little different in kids. But they've certainly gotten to a point where they often feel like life isn't really worth living. Adolescence in particular is I don't know. I won't ask about yours, but if anyone ever thinks back to their adolescence, most people, it's a pretty rough time. And that's kind of part of it. There's very few people that go through that time unscathed. That's kind of the point, that it's a huge period of transition physically, socially, culturally, emotionally. There's ups and downs. You're having your heart broken for the first time. You're undergoing the kind of stresses of high school for the first time. You're probably encountering the kind of nastiness of the world, hopefully outside of your family, but unfortunately sometimes within it. And that's a huge adjustment for young people. You hope that they have the people around them to help them get through that, and the resilience to get through that is bedded down in the earliest years. But sometimes that's not always the case, often through nobody's fault. That's unfortunately just the way life is for some people. And you're hoping, again, coming back to that idea of hoping to give young people a chance to feel safe in a relationship, to have a person to listen to and talk to give them guidance potentially. Again, it doesn't even have to be a professional, but any person to help them then correct the course that they're on, to help them maybe heal through the pain that they're experiencing, to overcome it, to move through it. Pain isn't always about curing it or fixing it. It's about experiencing it, living through it, and learning from it, which is quite a profound experience and kind of a difficult thing to explain to a 13-year-old sometimes. Wouldn't necessarily put it in those words, but I think it's the privilege of getting to be with someone at that point in their lives and helping them through that stage. And hopefully then a kind of expression is building a life worth living.
Yeah.
I think that's often the kind of the fix, if you're looking for a fix to someone who has suicidal thoughts, who wants to hurt themselves, which unfortunately is quite common in young people in particular. It's about helping them build a life worth living, so that actually that trying to hurt themselves doesn't really make sense anymore.
So for a child or adolescent that's going through a pretty severe case of depression, what sort of medication would you prescribe, and how does that medication work?
Obviously, medicines are typically not first line, and again, it's a fairly serious undertaking, and often left to sort of specialists like myself, although many GPs do feel confident and are perfectly appropriate that they prescribe them. Often the medicines that you would prescribe first line, once other things have been tried ideally, would be very similar to the medicines you would try in adults. So the kind of class of medicines called the serotonin reuptake inhibitors, become commonly called the SSRIs, and that includes medicines that many people would be familiar with, like the Prozac, Lovan, Zacton, Lexapro, these kind of medicines. We would typically use them because they generally have the best side effect profile. They're overall very safe. No medicines are 100% safe. And that's why it's a sort of an area that it's a journey you embark on cautiously. But those family of medicines typically have fewer side effects. One thing I would say is that the evidence basis of studies and research in young people specifically would show that those medicines can be it can be life-saving, can be very, very helpful for many, many young people, but they don't necessarily work as well in young people as they do in adults for depression, for that particular, so for low mood. So their medicines are a very important aspect, but part of my work often is to counsel families, I guess, around, absolutely, we can use medicines, but you sometimes have to manage their expectations. I think, understandably, people believe that they're going to come to a doctor, get a medicine, and this will be the thing that will guide their child through this really difficult time in their lives. And it's very rarely as simple as that.
Exactly. So in your time as a psychiatrist, where have you experienced TMS? How did you get involved with TMS Hub?
I was lucky enough to do part of my training in sort of early training in Sydney. There's the Black Dog Institute down there, which is a centre of excellence for mood disorders and depression. And they are often the sort of national kind of leaders in lots of different research areas. And I know that they have a TMS arm. And I remember as kind of a young psychiatric trainee, first and second year, as part of our training, we got to go and sit with in a TMS clinic with the machines. And of course, you get to do that cool thing where they use the magnet to make your thumb twitch, which is quite a bizarre and weird experience. But it's quite a sort of a moment when you realize, like, this is something that's really acting on this organ up here, the thing that we're interested in. And the potential of what that could mean and what it could do. So that was my kind of earliest experiences of TMS. It really hadn't featured very much on the rest of my training or my career thus far. And I think that's a reflection of that it isn't a very well-known treatment. In psychiatry, even, many people would kind of know what you meant if you mentioned TMS. I would be interested, or I would suspect that there'd be many psychiatrists out there who wouldn't actually know very much about it, the evidence behind it, where that evidence has gotten to. Which is, I guess, part of the things that we really want to really spread is I guess, or promote, I suppose, that TMS is an option now and is something that has as good an evidence base as many of the medicines that we use, which is very exciting. How I became involved in TMS Hub, I was a friend of a friend, as these things often are, just hearing it down the grapevine and just someone saying that there's this kind of really exciting new prospect. It's now that it's Medicare funded, there's a way of making this treatment much more affordable than it has previously been, which is something that really interests me. In that, mental health care, all healthcare should be accessible and should be affordable to people, and as we live in the real world, but as much as possible mitigating the idea of people being excluded because they can't afford to pay. And so I think that hearing that really excited me and really made me kind of want to look more into it and understand it more as its potential.
Beautiful. I like how with the, when you're going to see a psychiatrist, you can also then get the referral to see TMS Hub, and you've got the 2-for-1 there. And you can still have your medication and wrap up that referral and get started with treatment with TMS in the one go. So that's probably one of the benefits of going with TMS Hub, to see him on the psychiatrist there. So that's really cool. Now, in your history with TMS, how have you seen the results work with kids and adolescents?
Well, so I haven't, because Medicare rebate is not available to under 18s at this time. The reason for that being is that, like in many things, and this is one of the interesting areas of my specialty, my field, is that to do research trials on any treatment in adults is complex enough in terms of making sure people are making informed decisions. They're embarking on an experimental procedure, for example, that they can make informed choices for themselves. When you get under 18s, legally, psychologically, ethically, it becomes a little bit more tricky, because you're talking about young people who, in many, many cases are, perhaps have greater capacity to make those decisions for themselves than many adults. But, obviously many maybe don't, or we would kind of, in the same way that we wouldn't give them the vote, or we wouldn't, they wouldn't be allowed to enroll in the army beyond a certain, before a certain age, or get married and so on. Allowing young people to then be part of research trials is more challenging, and I suspect more expensive, which is obviously going to be a barrier to that. So the research base is much less than for adults. There's still some there, and there are people out there, thankfully, that are doing it, often at universities around the world. There's some very exciting research that's showing that it is safe and that it is effective, but we're not quite there yet. And I think it's really important when you have a treatment like this that we do it properly and build the safety evidence, the efficacy there to make sure to know that it works, so that I can look someone in the eye and say, I really think this is going to work for you, and I think it's the right decision because it's safe enough, like I do for anything that I recommend to my patients or people I meet. At the moment, we're not quite there yet, and history is littered with examples of treatments that maybe we've gone a bit too fast, too quickly, and then suddenly the cat's out of the bag, and you find a few years down the line that actually it's quite harmful, or it does things we didn't expect, and then that's not good. I don't want to hurt people. I don't want people to come to more harm than good than the treatments that I recommend.
So for adults, when it comes to treating anxiety or depression, how do you find that TMS fits into that as a part of your toolkit?
So the evidence base, or how it's been developed, has been as, I guess, this sort of second or third line treatment for people who have tried medicines and psychological therapies, and that they have not been enough. And you'd have to be very honest and say that actually is quite a large number of people who have depression and anxiety and many other mental health disorders, is that the medicines have not been able to give them the relief that they deserve or need. And neither have the psychological therapies or other treatments that we have in our armory. So TMS has then been, a lot of the studies that were done were in those individuals, or that group of people, of which, as I said, a reasonably large number of people. You're talking about 15, 20, maybe even more % of the total number of people who develop depression will be in that category. And then trying TMS with them and finding that for a very large number of them, they get better. They got better and they stayed better. And that is the sort of excitement around that. But then, of course, like in a lot of things in science and in medical research, you never ever trust early trials like that. You have to build more and more and more, and you need to kind of have hundreds of thousands of people ultimately. And we're now in a place, a couple of decades down the line, where we have that. We can we can say with almost certainty that we know that this is a treatment that will really work for a sizable number of people. You're talking 40, 50, maybe 60% of people in that situation where lots of other things have not tried. We're now in a place where they're doing studies where before even people have tried medicine, they're doing, well, do you want to try TMS or do you want to try the medicine? And you do the trials, and the early trials are showing that TMS can be as good, if not perhaps even a little better, for depression. So that's very exciting because, again, like we said before, there are no 100% safe treatments. Everything comes with potential side effects, and it doesn't mean that people will get those side effects, but there's always that risk, and you have to inform people of that, make sure that they're making the right decision for them. But overall, TMS seems to come with far fewer side effects than the medicines, and undergoing a course of TMS, and from kind of talking to people and witnessing people going through it, and from the studies as well, seems to come at far less a cost than many of the medicines do, which is, again, very exciting.
So, Dr. Henderson, in your time as being a psychiatrist, what would you describe anxiety being?
It's funny because if you ask a cardiologist what is a heart attack, like you give you a pretty quick and easy answer. Psychiatrists aren't so lucky. I think I always preface that question when people ask me that by saying, and again, I think honesty and humility is incredibly important in our profession. I think you can go quite wrong if you don't abide by those two tenets. I think it's, to be honest, we're dealing with an organ, so the cardiologist is dealing with the heart, the psychiatrist is dealing with the brain. And the brain is probably the most complex object that we have in the known universe. We know so little about it compared to what there is to know, I suspect. We know a lot. I don't want to reassure people that there's plenty of very, very, very smart people out there, far smarter than I, who know a lot about the brain and how it works. But we've got to also be honest about how little we know as well, and how far there is to go. Anxiety obviously is something that then comes from the brain, ultimately, the mind. And to say anyone knows exactly what that means, they would be maybe stretching a bit to say, I know exactly what anxiety is. But essentially, anxiety is a group of disorders where our fear response, which it's important to say is a very natural, normal, healthy thing to have. We should be afraid of some things. It's important because that keeps us alive. It's a fundamental aspect of our day-to-day lives that you want to be a bit afraid of moving traffic next to you when you're walking on the pavement. You want to be afraid of the sun beaming down on you that, could give you sunburn, something, and maybe worse things. It's important to be afraid of those things. But the fear response can go out of whack. It can get out of control for some people. and it can lead to situations where they're becoming very, very afraid of lots of things that actually there's no need to be afraid of, or maybe the reaction to those things is out of proportion and is impacting on their lives and stopping them doing things, leading the lives that they deserve and should be living. So that's sort of in a nutshell essentially what anxiety is. It can come, as I said, there's many different types. There's phobias, where you are afraid of a single thing, but in a disproportionate way. So, a phobia of perhaps spiders. Now, many people would argue that, being scared of spiders is probably a healthy, natural thing. But obviously, to the point where you're vomiting, you can't enter your home, to that level, you would call that an anxiety disorder, phobia disorder. You can have generalized anxiety, which is, again, your fear response getting out of control on everything. The sky's going to fall down, tomorrow and the world will end. China's going to invade, and to that then limiting your horizons. You can't leave your house, you can't go to work, you can't function, you can't hold friendships down. You're constantly in a state of fear and panic all the time. And social anxiety, you could go on. There's quite a number of different ones, but it's sort of, at a nutshell, it's when that natural ability, that natural part of ourselves that feels fear just gets out of hand.
100%. Like I've noticed a lot of people these days, everyone seems to have some sort of generalized anxiety, and some people feel like there's a healthy amount to have, which obviously keeps you alive and keeps you working, but sometimes there's just an unhealthy amount of anxiety in people's lives where people won't even go to a party because they might not have the right other people there to help them be that coping mechanism to integrate themselves in certain situations. Or some people can't even just leave the house in general for unknown reasons. They can't even go out and take a nice little walk because they might feel like they don't have enough time, or if they don't leave right now, the day's over. What are some telltale signs in particular where someone's anxiety is actually getting the better of them? What would that look for the average person?
As I think if you were their loved one, what you might see, from that perspective, I guess might be that they stop doing things that you might otherwise have expected them to continue doing, things that you're like, oh, you really enjoyed that. Why? What's happening for you? Like socializing, going to parties, like playing sports. That might be a kind of an early sign that their mind is starting, the tail is wagging the dog. Their mind is now taking over and making them do things, or stopping them doing things, probably more to the point, than them getting to make choices and live the life they want to live. And of course, some might turn around and go, I'm just not that interested in parties anymore, and I'm growing up a bit, and that's a bit something I did in my 20s and I don't do in my 30s and 40s now. And that's fine. But I guess that might be a kind of an earlier sign that you might pick up on. From a person themselves, and this is the kind of awful thing about many mental health disorders, is that they can creep up on you, and they can kind of get out of hand before you know it. So I think it's a very pertinent question about how can you pick it up early. When is it now no longer healthy for me? And I think it's probably about being honest and asking yourself, or asking people around you, getting their feedback, because they'll be aware of your blind spots and be able to kind of fill them in for you. How am I doing? Am I now not doing things that I used to do? That actually, why don't I do them anymore? Is it because I'm actually afraid to leave the house? Or perhaps some of the rules that I have about myself that, yes, certain people need to be there, are actually getting a bit out of hand and holding me back. I think, with anxiety in particular, when you're getting to the point where you might have what we call panic symptoms, and panic symptoms are really that moment where your nervous system is so activated, your fear response is so out of control, that you're actually experiencing it physically in your body, and people feeling sick, starting to hyperventilate, they can't regulate their breathing, they can't think clearly. They might have pains, or particularly chest pains are quite a classic one, and then of course, that comes with a whole bunch of anxiety about why I'm getting chest pains. So I guess when you get to the point where you're really kind of having physical symptoms of anxiety, that's probably a time to really think, I probably should get some help with this.
And how can TMS help with managing someone's anxiety?
So as we talked about before, most of the research done initially with TMS has been the focus of depression, and that being depression. By depression we mean obviously a disorder of your mood, where it's very, very low and kind of trapped in that low setting. and unable to feel pleasure, unable to feel happiness. Anxiety can come with that, and often they do overlap quite a bit. But anxiety, again, like I said, is more about that fear response. There is a lot of research into TMS use and anxiety, but it's a little bit behind where it is in depression. But there's certainly very good evidence that it helps a lot of people, and I've certainly clinical experience at TMS Hub has been that there's lots of people who've really noticed quite dramatic improvements in their anxiety. In terms of how it can help, you then have to kind of go back to what our understanding of how TMS works is to kind of answer that question. So if you imagine depression and anxiety in particular are disorders, in a way, one way of thinking about it is there are disorders of learning. You've learnt things or internalized messages that are now on replay in your mind over and over and over again. I'm not worth anything. I'm rubbish at this. Nobody likes me. That's very frightening. Someone's going to hurt me. Something bad's going to happen. And they can become illogical, irrational, but they just, we all have these little voices in our minds that sometimes they're louder, sometimes they're quieter. And it's when those voices saying those things, really negative things, go over and over again. And from a biological perspective, what that probably is you have certain pathways, certain nerves in your brain that have wired together. They've connected and they're on a little feedback loop. They're just playing over and over again. They're firing over and over again in your brain. And we know that then that has a knock-on impact on other parts of your brain, other parts of your body, and that it's functioning. What TMS seems to do, and you can show this in sort of before and after imaging and scans of people's brains and brain activity, and also in looking at animals and looking at their brains after TMS, is that undergoing a course of TMS seems to actually wake up certain parts of your brain. And it seems to get certain parts of your brain firing again and starting to connect and form new connections. And what essentially if you put that into kind of day-to-day language, what does that mean for the average person? It means that they're learning new things, they're learning new pathways, and hopefully the voices that were so loud will get quieter, and new voices that said, why don't I just give it a go? It might be a bit scary, but why not just try it? Or look, I know you think everyone's looking at you funny, but who cares if they are? You want to do this, do it anyway. And that those new pathways start to bed in. Those new voices get a little louder, the other voices get quieter, and then that leads to people kind of trying things, behaving differently. And it's that behavioral change that ultimately is what actually helps you out of your anxiety.
Wow. What is your basic definition of depression?
It is when someone gets stuck, their emotional thermometer, if you imagine going from cold to hot, from really kind of sad, low, depressed up to kind of incredibly elevated, euphoric, happy, it gets stuck on the low end. Obviously, humans, emotions are part of our lives. They are what give our lives color. And it is normal for us to feel sad, and it is normal for us to feel happy, and everything in between. And we should be kind of going up and down that scale, ideally in response to things that are happening in our lives. What happens in depression is that you get stuck on typically the lower end of that thermometer, and it's you're unable to feel other things, to feel pleasure, happiness. Some people have actually described to me that it's not even necessary that they feel sad, it's that they feel nothing. That there's this awful emptiness, and like I said, the color drains out of their lives, and that's beyond awful. And I think that the pain and the suffering that people describe when they're depressed is very hard to put into words. And just interesting though, when you think about the neurobiology of this, the parts of our brain that light up when we feel pain, we break our arm, when someone jabs us in the side, when we stub our toe, are actually the same areas where we light up when we're experiencing emotional pain. So emotional and physical pain, when you actually get down to it and how it's experienced in the brain, is very almost identical. And I can't imagine the awfulness of experiencing something like, the pain of breaking an arm, but there's nothing, you look at your arm, there's nothing wrong with your arm. Yeah, it's all inside. And as human beings, we connect, we relate to each other. That's a central part of our existence. It's almost impossible to be human without being in connection with others. And, if someone walks towards you and has a very obviously broken arm, there's an emotional response you're going to have, and it's going to elicit a care response, and you're going to go, my goodness, let's help you. But in mental illness, in depression, you're experiencing the same pain, but there's nothing there on the outside to really actually show that you are in that pain in the same way. And that's part of what the isolation that people experience as well.
100%. It's losing that connection to the outside world with your being and what's going on around you, which is tough. I really appreciated the way you painted the picture of how when you're depressed, you can almost feel like you've lost the color in your life. I personally work in a very colorful industry where I have to maintain being who I am to a T, which is being colorful. But when the color's not there, how would you suggest someone, what are some methods for someone to inject that color into their life? What are some methods besides the traditional like medications or TMS therapy to help support bringing color back into someone's life?
I think that's a really good question, because I think that is the work. That is actually, it's those things that often, like I said before, that actually help people overcome mental health episodes, illnesses. The medicines and TMS and the therapies are often there to help people get there, but it's the behavioral change that they make in their own lives that often is the thing that brings that color back. I think something that should never be underestimated is the power of movement. I used to call it exercise, but a very wise person told me that actually you shouldn't call it exercise because that puts a lot of people off. And we don't all exercise. I'm not exercising right now, but I should be moving. We should be moving. And you'll notice many people who are in the depths of a mental illness stop moving. That you can see it physically in their bodies that they're not okay. Movement, we now know that certain degrees of, not even that intense exercise done regularly, can be as effective as many of the medicines that we prescribe if you can get people doing that. So movement, getting into your body, experiencing the world through that body, because that, in many cases, inevitably leads to joy. You go for a walk. Well, why do you go for a walk? Because you suddenly encounter a place or a person or experience you didn't expect, and that is the joy of life. And then suddenly you might get a little of that color injected back into things again because you were out there doing something, moving, using your body, using this beautiful thing that you've been given and connecting with it. And suddenly then feeling good about yourself, feeling, I did that. I went for a walk today. I felt really, really bloody hard to get out of the house and do that, but I did it. And that's the other aspect, is finding the wins, finding the small things that start to build back a sense of, I can do this. I am a good person. I am worth it. I am lovable. I am worthy of love. Because I can do these, even though they're little small things. One of the things about society today is that sometimes I think there's such kind of fanfare made about certain achievements, and this is very intensely talked about, these certain achievements and goals we should all have. But the pathway to a happy life is to find the little joys and wins and achievements in your day-to-day life, because that's you only get to pass your graduate degree once. You only get to buy the car once. You only get the promotion once, and then the way our brains work, the next day, actually that joy is kind of diminished a little bit because it's happened, it's now in the past. Whereas if you can learn to find the little things, the little wins every day, that is a way of rebuilding very gradually and slowly. If you've lost the color in your life, is injecting it back in again. And you talked about, one last thing, talked about connection as well, and about that idea of, human beings are social animals. Our brains have evolved. We have massive structures in our brain that are all about communication and connection. And mental illness often robs people of that. They become isolated, as we talked about. So to reconnect them back in some ways, to help them overcome the barriers in their own mind and often in the external world as well, to connecting back again with humans, to feeling the joy of being held and seen by another person, understood by another person. It does an immensely powerful thing to then bring color back into your life.
100%. Great answer. Look, I know we've got 2025 approaching us, and everyone gets those feelings of going, I'm going to be a new person, new me, new year, new me, let's go. And people find that they start making these changes, and they're 3 days into the new year, they've smashed their salads, they've gone for those walks, those runs. But then maybe after a week or a little bit less or longer, they've fallen off the bandwagon. What would you suggest when it comes to making a big change in your identity or yourself as a person or your behaviors? What are the key critical factors in which will set you up for long-lasting success?
I love. So I'm chuckling at that because there's a whole industry set up around this of how to help people create change in their lives. I think the one, and I don't want to pretend that I'm an expert in that because I'm not. I think obviously my goal is to help people make changes and positive changes in their lives and to feel better, to live better lives. But like I said before as well, part of my job as well is for people to live in pain, the pain that they're in, and actually there's no running away from it. There's no going over it. There's no going under it. It has to go through it, as the book goes. And that's a really difficult thing, I think, for many people to understand in society. Really, there's messages from a lot of people is that you can dull out the pain or the suffering that you're going through. Sometimes you have to grapple with it, and that's human existence. And it's important to have people with you to go through that. One thing that I would say, if you ever want to change things, is you must first of all accept the current reality. Change that cannot happen until you understand what point A is. You can't get to point B from point A if you don't understand what point A is. And I think that's a really crucial part. Is people, I think, are motivated to make change because they don't like something as it is, and that's fine. That's a motivation. But I think you have to understand why things are the way they are right now, and why it is you want things to change, and accept them to start with before you can start making that change, if that makes sense.
100%. And I think it's also important to sort of understand, what does that change mean to me if I actually get it? Because there's times across my journey in particular where you go, oh, I'm going to get to this sort of level in my career, I'm going to build this up, and then you get there and you don't actually celebrate that being that you've dreamt of, and you're sort of already looking to the future. In a way, that's basically anxiety, where you're not focusing on the present. What are some recommendations that you give someone to help them be more in the present, to keep them away from too much future thinking?
I think mindfulness is something that's been around a little while now. I think it's become a little passé. I think people are a little sort of like, oh, mindfulness, yeah, tell me to breathe. But I think what you're doing in mindfulness, and mindfulness is a very broad term that covers a great many things. It's not just about apps and breathing and things like that. It's about exactly what you're talking about. It's how to bring yourself back to the present moment as much as possible. And I think what you're doing there is you're actually exercising a part of your brain that needs to be like developed like a muscle. You need to practice it. It's something that's very hard to do at first, just in the same way that lifting weights is often very unpleasant to start with. I mean, for me, it's always unpleasant. It remains unpleasant all the way throughout. But, it's something that if you want to build certain muscles, you have to practice them. You have to exercise them. And there is a part of our brains which we know is responsible for that ability to stay present, to be in the present moment and effective. You can only exert change, and you can only impact your environment once you're in the present, because this is where the environment is. So by practicing that muscle, by practicing that part of your brain through something like mindfulness, that can be a very powerful tool. And sometimes just doing that in and of itself is enough to alleviate anxiety. For other people, I think it's an important first step in then making further changes once you have that tool, once you have that ability to be present.
So there's a common talk about, what antidepressants are and how that relates to psychiatrists. But what is a depressant? Is there common forms of depressants in our day-to-day lives that people aren't actually quite aware of?
Yes. I suppose, an antidepressant, I suppose, is, that's a medicine that you're taking, a chemical or whatever it is that you're putting into your body to then try to improve your mood or improve your mental state. A depressant, kind of following the same logic, would be, external things that happen. The most obvious depressant is negative experiences. It might not be a thing that you ingest or breathe in or anything like that. It can actually just be the experiences you have around you. We talked before a little bit about working with young people, and they're the young people that I'm meeting that have struggled or have struggles now. It's often you look back through their past and their lives, and they're living through experiences that are immensely negative, where people are either very cruel to them, do things that they shouldn't be doing, whether exposed to awful events, that the brain, absorbs and takes in, and that in itself can be a depressant and can impact on your brain's functioning. I think there's the obvious ones where we talk about depressants. We're talking about alcohol often. That's something that is slowing your brain down. Now, obviously, it's the classic thing when we all do it. Well, many people, not everyone, but many people do it. They'll take it and they get the initial, the rush, the pleasure of drinking something like alcohol because it dulls down some of the anxieties and worries that are there every day. But then there's always that inevitable crash. There's always that inevitable long-term impact of something like alcohol that actually reduces your nerves functioning. And again, probably impacts a little bit on the color of life because your brain activity is decreasing. And I think in terms of ones that are maybe less well known, I think food's probably a big one as well. There are many foods and things we now know more and more about the harms to our brains, to our bodies more generally, about certain food items. Air pollution, it's another big thing, the sort of connections with that and our bodies functioning, our brains functioning. So there's not to freak people out, but there's probably a great many things out there you could classify as depressants.
Yeah. And what would you say are some of the key aspects in which people should look intensely at whilst they're trying to make a transformational change with their mental health and their physical health?
I think I would probably come back to connection again. I think exactly think about talking about making physical changes. Like it's pretty common knowledge. Most people are probably more likely to make changes in terms of exercise or regimes or habits around their physical health if they're doing it with someone or with people. And if you're connecting with other people that are going through that process, it is far more likely to work. Think about drug and alcohol rehabilitation. In almost every case, that's typically done in a group setting or in a community of some kind, or traditionally anyway. And again, not in every case by any means. Many people do it themselves, and that's the way that it works for them, and that's wonderful. But in my experience, in most cases, it's greater efficacy if you're doing it in connection with other people. So I would suggest to people, if they want to make big changes with themselves, is to think about, well, who am I going to do it with? Who am I going to talk to about it? Who's going to give me feedback about it? Who's going to inspire me to stick to changes, to make different choices? Who's going to hold me accountable? You got to love someone a lot to tell them when they're wrong and to be able to tolerate the discomfort that brings up. I think love and connection and it sounds very corny, or maybe it doesn't, but I think love and connection are incredibly powerful things that really shape our lives. And again, we live in a culture and society and a zeitgeist that in some ways counteracts those things. And I think we have to be very mindful of that and make sure that we're aware of that in our lives and how much these things impact us in becoming isolated, staying on our phones, not going out and meeting people, not connecting with people, not talking to people about how we're feeling, what our experience is. Those are things that ultimately, as we become more atomized, will make change harder.
And like you were saying with the phones, obviously in the past, since the iPhone touchscreen came out, the whole having access to emails, your social media on hand in your pocket all the time, it sort of changed the way we think and act and feel these days. Do you have any recommendations on people how to develop a more healthy habit with their phone, or essentially even, is there any questions that you could get people to ask themselves why they're using their phone in a way that they know is detrimenting themselves?
Well, you're talking about addiction, aren't you?
Yeah.
That's one of the definitions of addiction is a behavior that you continue to do even when you become aware that it's harmful to you, or other people are aware that it's harmful to you. And that's a really crucial question. Is as you said, the advent of this technology, it's incredibly powerful, and wonderful, and like any technology that is that powerful. It's not all bad. You wouldn't want to throw the baby out with the bathwater. There's incredible good, and there's lots of connection that does happen through our phones. And actually, arguably, it's a connecting tool. If you believe Mark Zuckerberg. But I think it's then about people taking a pause, stepping away from it, and reflecting about, on balance, is this a good thing, or is this is it a net good or a net bad for me? How do I feel after I use after I'm doom scrolling at, midnight, how do I feel after that? Is that actually good for me? It is a little worrying for me because, because it's such a powerful technology, it has an ability to obviously, enter directly into your brain. It's sitting there, the world's at your fingertips, but that means that the world can get to you. And, many of the ways that a lot of the technology we have now, particularly the commercial technologies, they're designed to hijack our neurology. They're designed to hijack our brains and actually, a bit like an addiction, sort of start to kind of make decisions for us where we're not really thinking for ourselves. So I think coming back to that idea of being able to step away and just reflect, put the phone down, put it away, and reflect a little bit on your use of it. How does it help you, but how does it maybe not help you so much? And then, there are a great many apps out there now. I understand that similarly to how many apps and many sort of social media and so on are there to hijack your brain, they're there to try and counteract that. So there's things that put timers on how long you can look at your phone for, that then shuts your phone down for a period of time. Things like that can try to break that habit, I suppose.
So, Dr. Henderson, in your experience as a psychiatrist, for those who are struggling with their mental health, in particular depression and anxiety, where they've tried all the options, all the medications and all the talk therapy that they could ever try, how do you believe that TMS could be an additional help for them to get to where they want to be?
Well, I think it's a new technology. Relatively new. It's been around a few decades, but obviously now it's something that is becoming more widespread, widely known, widely used. Its evidence base was originally developed in that exact situation where people have tried everything else, and what's left to try is some pretty kind of out there stuff. Let's put a big magnet next to your head and see what happens. And what we found fairly consistently across millions of different treatment episodes now across the world is that it can help people it can help bring them out of depression. It can actually bring them out of anxiety to the point where their symptoms go away completely. Perhaps not forever, but certainly, potentially for many months, many years, which again is a very exciting thing, very exciting option to have to offer those people in that situation. So I think that's its exact place, is at the kind of end of sometimes what's a very long journey for people, maybe longer than it needed to be. And I guess that's what our hope for the future is that as this becomes more widely known, that people might consider it sooner and not wait so long. But this is a treatment that is there for people when other things haven't worked. And it can also work alongside, and it should really work alongside other treatments. It's not about sort of giving up on everything else and this being the one thing, although for some people that might be the way that it is. But often that it can work very synergistically with talking therapies, and with other behavioral changes that we've talked about, like increasing the amount of movement or exercise that people are making, the amount of time they're spending with the people that they love, making connections with other people, and the time that they spend maybe just considering and thinking about how they're living their life, the choices they're making around smoking, alcohol, eating, that kind of thing.